patient safety day. Why? They don't see one, any 10 patients where they go admit na hospital, one they die because of patient safety issues. And if we bring account to we country salon, we all don't see the data. This book where una see na me hand so. This book na maternal death surveillance and response. Mean say we don dey systematically take stock of women the way they die, wetin dey kill them, and wetin we for do as a country. And inside this book, it don't tell we say for the past 5 years wey we dey collect the data, sepsis wey we can literally call infection, they either dey number 2 for kill woman or number 3 for kill woman. Because of that issue, now make this country, Ministry of Health, it want join the global people for commemorate or for raise awareness on patient safety issues in this country. Then data don't also tell we from child death audit report say the pikin them back. Sepsis they kill them more. Woman they work it go na hospital, but it go end up for day for long period of time, up to 1 month. Sometimes even when it discharge, you go home, you get for they go constantly for dressing. Why? Because a wound gets infected. Or it go born the pikin. If you go na the newborn unit, na their hospital, pikin then they treat them with sepsis. Number 2, Sierra Leone na the country where we don see say if you yourself wey sit down dey look me, you dey go treat yourself. Una don make drugs, antibiotics, what we dey call drug, una dey buy am easily. So una don become resistant. Mean say if you sick now, you go na hospital, they wan give you antibiotic, then they give you more specialized one. Then they don't cost government too much money, and it don't make the easily available drugs, the antibiotic we get in this country, we don't abuse them. So all land in a safety issue. The other thing, most often you dey go na hospital, then give you medicine, they say take either 210 for the day, 310 for the day. When they give you medicine, they say take 310 for the day. The day na 24 hours. Means say na every 8 hours apart you for take that medicine. But no, people they not they do so. When they go home, the time when they eat in the morning, now they take the first one. When they eat back Santa, they take the second one. So you drug, you know they take according to the schedule. So it don't become resistant. Instead of the drug, it help you for cure you, you don't become resistant to it. So now if you sick again, you go hospital, then they give you the one way past the one where you be done they do. Additionally, when we been get Ebola, all man be the worst in hand, not also. Now we get COVID. Even when they say let we use mask or let we wash we hand, and they tell you we not they still do it as a country. So all landing are issues around safety. The other thing, you dey see today when somebody sick. So all landing are issues around safety. So the other thing, you dey see today when somebody sick. When somebody sick, that cannula then they give medicine. The person that needle can depana for weeks. So even from that site, it they get infected. All a safety issue. We hospitals then, we know the condition. When one patient deliver or a woman born, you supposed to clean that place there and wash there with very strong detergent, because we know say viruses and other microbes then they travel through that source there. But because sometimes we constrain, and as a country, we for now work with government to make sure say we hospitals then clean. Let it not be place where say you dey go again, you get infected. So based on that here, now I make we want today for raise awareness, let you know wetin they make people then they stay in a hospital and it dey cost the government more money when patient go na hospital e no do cesarean section operation. Maximum na 1 week you for do na hospital you go home. But you dey find out say when patient go then do am, e dey na hospital for weeks. E dey cost stress for im family, stress for im husband or partner, stress for even himself, and some in that case then they end up for loss. Make today we come. The other issue na around blood transfusion. Blood you dey only give where you need am, and e for be the last resort. But we all don know say blood na there you dey get HIV, na there you dey get hepatitis, and Sierra Leone na the country where they sick then they still then they with we, and some other conditions. So blood need for be safe before then give. So based on
we deliver services to our mothers and our children is outside the issue of prescribing practices, communication, even the examination history taken of our patients is communicating to our mothers. I'm happy that we have our pregnant women here on top of our health providers, because it is very important if we aim as practitioners to prevent the maternal mortalities that we've been seeing in the newborn care issues, and even issues with child mortality. I know that as a country we have done very well to reduce all these indices over the years, but communicating to our mothers in terms of how to take care of themselves even outside the facilities. We know that a lot of the patient safety issues happen in the facilities, but even at home. So we have our pregnant women here at antenatal. How much time do we have to speak to them? We are talking about focused antenatal care, but how focused is our antenatal care? Do we just see them through the line, okay, how are you doing, and then you just write whatever we need to write for them? Or do we take our time to communicate with them, especially when it comes to what to look out for in terms of danger signs? We've seen, especially when it comes to our MDSR, which Mr. Mana showed the report to us, some of the issues that come up which have to do with delays. We realize that a lot of our mothers are not even able to know when they are in danger. She's pregnant and she's bleeding.
And today, as Dr. Pearl mentioned, the focus of World Patient Safety Day is around providing care to maternal and newborn. And we have to ensure that that care that is provided to them does not cause for them to die. And we know that across the country, data is showing that mothers are dying at preventable reasoning. So we have to ensure that we work together, healthcare workers, district health management teams, national programs, that we work together to ensure that women do not continue to die due to avoidable diseases and causes. So
certain sickness. Then we also there for the nurses them. You can see certain time then they were nurses then can want for strike, then can get one for get ala with central government. You see say health for all college can come between for advocate between the central government and the Ministry of Health for ensure that everything well. There are a lot of advocacy where we don't do. But also with all the health workers they are accountable. With all the health workers they are accountable. For ensure that we colleagues that also be the talk practitioners say you get certain things that where the healthcare workers they're supposed to do. Then get their responsibility. So health for all college also they ensure that we check, we able to verify, and we all the service providers then what they call the health workers they accountable on what thing they're supposed to do, what thing they're supposed to provide to the beneficiaries them where actually no they do. Then the bigger part also where we involve on now for advocates. We don't.
I want you to know, I want let una know at this moment say I don't do in service delivery for the better part of my life. What say service delivery? That will side and they give the injection there. Also would they admit the patient there? Also would they wash the patients there? All them side and then they have been done there. At this time we be a woman and then yeah, not to so. We be one man will be saying say pregnant, not bad at all. So we be a woman them we say We love una and what una dey also. Na I'm glad we ask because if we dey talk about wetin ever we don't get an answer today, una so important. Not to say we don't get man patients there, na woman patient they no more get to. But reason dey where they can't tell una shortly as I dey go into the activities of this day. So I want to tell una not a story at the pull. Now waiting this day I be how it come about. Waiting the way people they all don't let the dog and decorate this place fine one so for let's sit down here. Now that's how they come for can talk about. So at this time, not so we are no more now with audience. We know say other Sierra Leoneans and the way they listen to we. So and we glad for that because health business now all man business. So the talk where they can't talk so now see we don't happy long time ago. And salon will be not a year. So say they not to follow just understand things. So you don't hear now one step ahead. So this day as we don't get out of this car park. Now important reason make we don't get that and another reason and they make they can't talk now the simplest form because me want to up here so I be teacher back so I can teach as well. So this day as we call out patient safety day, when I say patients, somebody will need care. He don't come to other person for let you help him. And that person where they cancel, you for make sure always say it's a bit past you. Now I'm gonna make sure you cancel him. Because this now people then they talk about healthcare, we no say
speak none. Not to where we sabi one, we go take and forbid the other one, we go take down a quick time, I can't reach you. All patients are equal.
The problem is wisdom is everything. We don't know. So if person, doctor or nurse or pharmacist tell me say they can take a 1 in the morning, 1 in the evening, I don't know if it's every 8 hours. So I go to watch if evening they start at 6, I take my medication. In the morning probably at 8, I take them. So you know they be systematic. So thank you very much for that important information where you say now after every 8 hours you for take it on. And one of the things I also noticed, I think one of the nurses like Kiama when I have been a beneficiary from both government and private hospitals. Now sometimes when you go to the hospital, I am a victim of that. Whether they give you a drug, for example, I think government hospitals they give you drug, malaria drug when they buy. And when you go to these hospitals and then they give you the drug, what they do is they just open it and then they give it to you. When you they ask the nurses and ask them say, why, what is this? Most times they get offended. And I think you are there for us. And I think information is important when it comes to drug taking. So I think, thank God that most nurses are here, they will convey the messages. And I think that is also part of patient safety because when the patient asks you say what in this, I think if you give them proper information, tell and say this is the malaria medicine, and the reason why they take the malaria medicine when I get belly because what we know is when you get pregnant, when you get belly, you don't for take malaria medicine. So you make our understand and say this malaria medicine what they take now for the baby or something, or from when you get malaria make it not affect the baby. So most times these nurses they get angry when you ask for certain informations. And also one of the speakers talked about IPC. I think that is an abbreviation. So I don't know what the meaning of IPC, we I don't understand. And